Welcome to Mini Lecture 1C, where we'll dive into bioethics in the laboratory. This topic is crucial because it underpins every decision we make in a clinical setting, guiding us beyond just technical proficiency. We'll explore how ethical principles apply directly to your work as histotechnologists, ensuring you're prepared for complex situations. Understanding bioethics isn't just academic. It's about making responsible choices that impact patient care and professional integrity. This lecture will lay the groundwork for navigating those challenging ethical landscapes you'll encounter in your careers. Let's start with a scenario that will challenge your instincts and highlight the complexities of bioethics. Imagine you've performed an HIV test on someone your best friend is dating, and the result is positive. This isn't a hypothetical situation. It's the kind of real-world dilemma that can arise in a laboratory. Sit with this for a moment and consider the immediate tension you feel. This scenario forces us to confront the difference between what feels right personally and what is professionally required. We'll use this dilemma as a touchstone throughout our discussion today. Our dilemma from the previous slide perfectly illustrates the distinction between law and ethics. The law dictates what you absolutely must or must not do, carrying strict enforceability. Ethics, however, guides what you should do, rooted in professional values and obligations. While some situations have clear legal and ethical answers, others, like our HIV scenario, present a genuine conflict of values. Understanding this difference is critical because legal compliance doesn't always equate to ethical behavior. We'll explore how these two frameworks interact and sometimes diverge in laboratory practice. To help us navigate these complex ethical waters, we rely on four core principles that guide decision-making in laboratory medicine. These principles provide a framework for analyzing dilemmas and making sound, defensible choices. They aren't just abstract concepts. They are practical tools for ethical reasoning in your daily work. We'll examine each of these principles in detail, starting with autonomy to see how they apply to real-world laboratory scenarios. The first guiding principle is autonomy, which centers on the patient's fundamental right to control their own health information and care decisions. This means the patient and only the patient decides who knows their medical results. In our opening scenario, the HIV-positive patient has the sole right to determine who learns about their diagnosis. Your role as a laboratory professional is to uphold this right, even when it conflicts with your personal feelings or relationships. Upholding autonomy is paramount. It ensures trust and respects the individual's self-determination in healthcare. Now let's talk about beneficence. This principle means we act in the patient's best interest, but always with their informed consent. It's about ensuring patients are fully informed about risks and that we treat them ethically. We must respect their decisions even if we personally disagree with them. Beneficence centers the patient's right to control what happens with their information. It's crucial to understand that this is not paternalistic. It doesn't mean deciding what's best for them without their input. We're here to support their choices, not make them for them. This leads us directly to the concept of doing no harm. Building on beneficence, non-malefisance is the ethical principle of do no harm. This includes harm caused by unauthorized disclosure of information. Our obligation is to minimize harm, whether it's physical, psychological, or social. This also means protecting individual beliefs and being transparent about the limitations of any tests we perform. In our scenario, an unauthorized disclosure of a test result could cause serious harm to the patient, leading to discrimination, relationship damage, or significant psychological distress. Telling your friend, even with good intentions, would violate this core principle. So, what about fairness and equal treatment? This brings us to justice, fair and equitable treatment for everyone, regardless of who the patient is. This principle means we allocate resources fairly and respect individual values. It applies to everything from access to testing to how we staff our labs and distribute resources. In our specific case, justice is relevant to ensuring equal treatment across all patients. The principle is central for making decisions about staffing, budgeting, and even population health. Now, let's see how these principles come together in our scenario. When we look at our scenario through the lens of autonomy and non-malfeasance, both principles point to the same clear conclusion. Autonomy tells us the patient controls their own health information. Beneficence means we must respect the patient's decisions about disclosure. And non-malfeasance warns us that unauthorized disclosure could cause serious harm to the patient. So the conclusion is unequivocal. You do not disclose the result. This holds true regardless of your personal feelings or your relationship with the person asking. This isn't about personal judgment. It's about professional conduct. This is why we rely on policy and procedure, not personal judgment alone. Confidentiality policies exist precisely so no individual has to make these calls in isolation. Ethical decision-making is a skill we learn and refine through experience. The best general guidance is always to follow your institution's established policies and procedures. When you're in doubt, do not act unilaterally. Instead, consult your supervisor, the compliance officer, or the ethics committee. This approach protects both you and the patient. But ethical issues in the lab extend beyond individual patient scenarios. We've talked about individual professional ethics, but ethical issues in the lab extend far beyond just individual patient scenarios. You'll encounter ethical dilemmas in 5 key areas, and understanding these categories helps you anticipate and navigate them. First, there's patient data, which involves privacy and confidentiality. Then we have social justice, which considers equitable access to care. Research ethics are crucial for studies and trials. Staffing involves fair management and workforce development. And finally, special populations require tailored ethical considerations. These categories are interconnected, and a decision in one area often impacts another. So, let's dive into the first 2 categories, patient data and social justice. When we talk about patient data and social justice, remember that privacy and equity aren't just good ideas, they are professional obligations. For patient data, this means handling health information with the utmost care, ensuring strict privacy and confidentiality at all times. It also means obtaining informed consent before any specific testing, which is a non-negotiable. On the social justice front, we're addressing the ethical implications of testing, particularly equitable access to care. Access to testing is a fundamental justice issue, and it has direct real-world outcomes for patients. These aren't abstract concepts. They directly impact the trust patients place in us and the quality of care they receive. Now, let's look at how our ethical obligations extend to research, staffing, and special populations. Our ethical obligations truly extend to every facet of laboratory operations, including how you conduct research, manage staff, and serve diverse patients. In research, this means maintaining ethical conduct throughout all clinical trials and laboratory studies, ensuring integrity and patient safety. For staffing, it's about providing quality supervision, ensuring equitable recruitment practices, and investing in workforce development. This creates a fair and supportive environment for everyone. And when it comes to special populations like pediatric, geriatric, or transgender patients, remember that standard assumptions may not apply. Each of these categories demands specific knowledge and intentional practice to ensure we're meeting our ethical responsibilities. Understanding these broader categories helps us prepare for the ethical gray areas we'll inevitably face in the lab. These 5 principles are your ethical compass, a quick gut check for almost any gray area you'll encounter in the lab. We're talking about foundational behaviors that ensure trust and fairness. Being honest and acting with integrity are non-negotiable. They build the bedrock of your professional reputation. You also have to accept accountability for your work, which means owning your successes and your mistakes. Maintaining equal access to services ensures that every patient receives the same standard of care, regardless of their background. And finally, maintaining confidentiality is paramount in healthcare. Patient information is sacred. These principles are not just ideals. They're practical guides for navigating the complexities of laboratory management. They extend beyond just research and staffing, applying to every interaction and decision you make. Now, let's look at how these principles often come into play in our daily interactions with colleagues. It's often in our interactions with colleagues that ethical lapses can quietly creep in, sometimes without us even realizing the full implications. These aren't always grand, dramatic dilemmas. They're often subtle choices that erode trust and fairness. Playing favorites among staff, for example, undermines team morale and creates an unfair work environment. Taking credit for someone else's work or ideas is a direct violation of integrity and honesty. Falsifying records or documentation, even if it seems minor, can have serious legal and patient safety consequences. And running patient specimens despite out-of-range QC results is a clear breach of accountability and patient safety. These are real ethical issues you might face as a manager, and they demand careful consideration. Understanding these common pitfalls helps us apply those core ethical principles we just discussed. Now we'll see how to apply these principles to a specific scenario in our first discussion. For our first discussion, you'll apply these ethical frameworks to a specific scenario involving HIV. This isn't about finding a single right answer, but rather about developing your ethical reasoning skills. You'll use the 4 core principles of bioethics: autonomy, beneficence, non-malfeasance, and justice to dissect the situation. Also, consider the 5 bioethics categories we've covered in this module to broaden your perspective. And remember to use the basic code of ethics as a gut check, ensuring your reasoning aligns with those fundamental professional standards. The goal here is to articulate a well-reasoned position, demonstrating your ability to navigate complex ethical challenges in a clinical setting. This exercise is crucial for developing the critical thinking skills needed for effective laboratory management.